House Leader of the Third Party.
Thank you, Mr. Speaker. My constituents on Salt Spring Island are days away from a crisis. Island Health is cutting funding for overtime and agency staffing in long-term care and assisted living. Eldercare residences on Salt Spring and across the province just got 1 month's notice of the change. This decision will have severe consequences for seniors, their loved ones, healthcare workers, and communities like Ganges. We know that cutting funding from one area puts pressure on another area of the system. We know that hospitals and housing are already stretched past their limits. Caregivers can't do their jobs when your government creates so much uncertainty and so little future-oriented planning. My question is to the Minister of Health. Will you postpone the long-term care funding cuts and work with the care sector to establish a fair and sustainable funding model for long-term care and assisted living?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you to the member for the question. Thank you for the conversation that we had earlier on this week, where he shared with me some of the details of what he is hearing from his constituents and from this facility in question, and I look forward to visiting Salt Spring Island together with him very soon. Mr. Speaker, I want to start by acknowledging just how hard long-term care facility operators and the staff in them have worked to support our seniors and how incredibly vital that is. Mr. Speaker, they've done so much to keep people safe, particularly during the pandemic, but then of course now as well. And as the member knows, we talked about in this House before, these were temporary measures that were brought in at an extraordinary time always meant as an emergency measure, but I know that the theme the third party has brought to the House this week is around reliability, and I couldn't agree more. Building a sustainable, reliable system that is not reliant on temporary measures. Mr. Speaker, that's why we're addressing the root causes of why that funding was needed in the first place. Mr. Speaker, that is around training more healthcare assistants, adding more healthcare aides to the workforce, paying them fairly, Mr. Speaker, improving conditions across the sector, raising the standards and making sure that we are meeting them, because there is nothing more important than taking care of the people who need this help and support the most. Thank you.
Thank you, Mr. Speaker. Healthcare isn't the only sector where British Columbians have been thrown into uncertainty. When this government cancelled the carbon tax in the middle of the night, they took away funding for an essential stipend that hundreds of thousands of low-income British Columbians rely on. With social and disability assistance rates well below the poverty line, thousands of people use that money to pay for rent and put food on the table. The carbon tax was a victim of weak-kneed politics and conservative fear-mongering. But boy, was it a good program. Combating climate change by making polluters pay. What a concept. Cutting the government's record deficit by bringing in $3 billion every year. Wow, that's a good idea. And yes, putting money in the pockets of BC's most vulnerable. My question is to the Minister of Social Development and Poverty Reduction. First, you cut the grocery rebate, then the climate action tax credit. Why are you making British Columbians' poorest citizens pay the price for your government's fiscal mismanagement and failure to lead?
Minister of Social Development and Poverty Reduction.
Mr. Speaker, thank you. We are in a time of such uncertainty, chaos from the United States putting jobs at risk and the cost of living putting even more pressure on people, that I'm so glad that the investments that our government has been making, guided by our poverty reduction strategy, British Columbia's first, and then our updated strategy last year, has put people in so much better place to be able to withstand tough times right now. That income assistance is up 74% since we formed government in 2017. In contrast, you'll remember that the Conservative leader, when his government was in power, they'd frozen income assistance rates for a decade. Where before the senior supplement had been frozen again, we doubled it and then expanded it again. And we're on an emergency basis, and any member of the public on income assistance who's having trouble getting by, please do reach out. We've got supports that are available, whether it's for food or making rent or medical supplements. We want to support people at this really challenging time, and we've got the system to do that.